Oke, Dokter Yahya,
Ya,
saya izin untuk memulai terlebih dahulu.
ya.
Baik, selamat siang dan salam sejahtera untuk kita semua. Terima kasih sudah hadir di channel ini. Selamat datang di acara webinar jurusan Kebidanan Fakultas Kedokteran Universitas Brawijaya. Saya Yusefa Saryati, saya akan memandu acara pada kegiatan seminar kali ini. Dan saat ini izinkan saya menyambut Bapak, Ibu, Saudara, dan Saudari, dan rekan-rekan sekalian, dan juga seluruh para pemateri yang telah hadir di Zoom meeting dalam salam kehangatan. Dan saat ini juga saya akan memperkenalkan para pembicara kita hari ini. Ada Profesor Louis Walker dari University of Nottingham, dan Profesor Deborah Turnbull dari the University of Adelaide. Kemudian Michelle Dimes dari UNICEF East Asia and Pacific Region. Dan Dr. Sutrisno, SPOGK, yang merupakan Ketua ID dan juga POGI di Kota Malang, dan sekaligus dosen di jurusan kebidanan. Dan salam hangat juga buat Bunda terkasih, Dr. Emi Nurjasmi MK. Selamat siang, Ibu. Dan terima kasih, thank you for taking time of your busy schedule, Prof. Deb, kemudian Prof. Dev, Michelle, and Prof. Louis Walker. Dan Dr. Tris juga. Baik, para hadirin sekalian, perlu kami informasikan bahwa acara ini merupakan implementasi program kerja jurusan Kebidanan FKUB yang berlangsung atas kerjasama University of Nottingham, the University of Adelaide, dan UNICEF East Asia and Pacific Region, kemudian Ikatan Dokter Indonesia, Perkumpulan Obstetri dan Ginekologi Indonesia Kota Malang, dan pengurus pusat Ikatan Bidan Indonesia. Baiklah, sebelum kita memulai acara ini, kami persilahkan kita akan mendengarkan dulu kata sambutan yang akan disampaikan oleh Dekan Fakultas Kedokteran Universitas Brawijaya yang saat ini Pak Dekan mungkin belum bisa bergabung, nanti akan menyusul, yang saat ini akan diwakilkan oleh Dr. Eriko. Silakan Dr. Eriko untuk memberikan sambutannya untuk kali ini. Silakan Dr. Eriko.
Baik, terima kasih Mbak Yusefa. Dengar suara saya?
Sangat jelas, Dokter.
Oke, baik. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Good afternoon, everyone. Our warmest welcome to our guest speaker, Associate Professor Louis Walker from the University of Nottingham. Good afternoon. Professor Deborah Turnbull, PhD from the University of Adelaide. Good afternoon. Michelle Dimes from the UNICEF East Asia and Pacific Region. And Dr. Sutrisno as the President of the Indonesian Medical Association East Java. Selamat siang, Dokter.
Siang.
Ibu Dr. Emi Nurjasmi as the Chairperson of the Indonesian Midwife Association. Selamat siang, Ibu. And the Honorable Head of the School of Midwifery FMUB, Faculty of Medicine, Universitas Brawijaya, Dr. Yahya, Head of the Study Program, both undergraduate and postgraduate, our professor and colleague, all of the FMUB, and all participants that we are proud of. First, let us praise to the Almighty Allah Subhanahu wa Ta'ala for His blessing, so that we could share our health and positive energy into the great event, also able to contribute to this country even in the pandemic through the virtual meeting. On the behalf of the Dean, I would like to thank to all of you for coming and joining the webinar held by School of Midwifery FMUB. I think this webinar take the actual topic on how the maternal health and adapting the new habit era. It's very important. That we already know that the midwife were the frontliner person in the maternal and child health services, especially in Indonesia. Also have much strategic role for the achievement of the quality services. To reach this achievement, so that midwife must have an extra knowledge, extra skill to understand all about the woman and child services for their health and safety, both of the midwife herself and the client, even in the pandemic situation. Through this event, I hope so many information could deliver from the great speaker to us about the maternal health itself in this era and how to make a good adaptation, not only for the system, the challenges, but the effect, but also how we can do the deal with this situation. We are greatly honored that this year we have an international guest speaker. Thank you very much for joining and share your expertise in this webinar. Welcome to our faculty. Welcome to our School of Midwifery, Faculty of Medicine, Universitas Brawijaya. During this event, I hope all of the participants could gain the new information and enjoy this webinar atmosphere. Also, let's give the highest appreciation to all of the committees and all the participants. I hope it's running well until the end. Finally, thank you very much for the attention, and please apologize for any mistakes during this event. Wassalamualaikum warahmatullahi wabarakatuh. Good afternoon.
Waalaikumsalam warahmatullahi wabarakatuh.
Baik, thank you Dr. Eriko yang saat ini mewakili Pak Dekan, Dr. Wisnu Barlianto untuk menyampaikan sambutannya. Sambutan yang kedua, mari kita dengarkan dari Ketua Jurusan Kebidanan kepada Dr. Yahya Irwanto SPOGK. Kami persilakan. Silakan Dokter.
Okay, thank you. Good evening, everyone.
Good evening.
The Honorable Dr. Eriko and our speaker and all guests from Indonesian Midwifery Education Association and from the Indonesian Midwife Association, UNICEF, Indonesia, fellow lecturers, students, ladies and gentlemen, Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi
Good
wabarakatuh.
evening. It's wonderful to see you all here in the online seminar with the very interesting topic, maternal health and the adaptation, the new habits era, that well organized by the School of Midwifery, Faculty of Medicine, University Brawijaya. We'd like to extend special welcome to the speakers, Associate Professor Louis Walker from the University of Nottingham, England, Professor Deborah Turnbull from the University of Adelaide, Australia, Michelle Dean from UNICEF, East Asia and Pacific region, Dr. Sutrisno, PhD, the President of Indonesian Medical Association, East Java region, and the last speaker, Dr. Amy Nurjasmi from the Indonesian Midwife Association. I am very happy to get to know all update knowledge and evidence related to maternal health during the adaptation, the new era, the new habits era. We cannot deny that COVID-19 in Indonesia and around the globe remain a challenge, particularly in maternal health, which the evidence is still limited. Therefore, by holding this seminar, I hope that all Indonesian midwives could enhance and update their knowledge and evidence on maternal health during this challenging era. And I hope that today inspires idea and discuss around the ways that we can make maternal health services in Indonesia become better in the future. Thank you again to everyone for being here today to have an online seminar with us. And in the name of God, let the seminar begin. Thank you and good morning, good evening. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh.
Okay, thank you Dr. Yahya. Baik para hadirin sekalian dan para pemateri kali ini, izinkan saya juga untuk menyapa dari para senior-senior bidan di Indonesia, dan pada kali ini juga dari AIPKIN juga hadir. Bu Yum, selamat datang, Bu Yeti dan Bu Loren. Selamat datang Bu di acara webinar kali ini. Terima kasih telah bergabung.
Terima kasih diizinkan masuk. Terima kasih juga.
Selamat ya.
Baik, para hadirin sekalian, sebelum kita mulai acara seminar hari ini, izinkan saya menyampaikan beberapa informasi terkait alur kegiatan seminar hari ini. Kepada panitia, Ningrum boleh tayangkan. Baik. Next slide. Baik, beberapa informasi terkait webinar kali ini, bahwa webinar ini disiarkan secara live melalui link YouTube dan Zoom Meeting. Dan kedua, peserta wajib mengisi link registrasi, absensi tengah, dan evaluasi. Para peserta dan juga para hadirin semua bisa melihat di deskripsi yang ada di YouTube. Jadi nanti ada 3 link yang akan terisi. Yang pertama adalah link registrasi, absensi tengah, dan evaluasi. Dimohon untuk mengisi link registrasi, absensi tengah, dan evaluasi dengan menuliskan nama dengan menggunakan huruf kapital. Sekali lagi saya sampaikan, isilah nama Bapak, Ibu, Saudara-saudari sekalian dengan menggunakan huruf kapital. Pastikan peserta menggunakan email yang sama di setiap linknya. Saya ulangi lagi, pastikan peserta menggunakan email yang sama pada setiap link yang terisi. Jadi ada 3 link registrasi, absensi tengah, dan evaluasi yang harus dipastikan bahwa nama menggunakan huruf kapital, dan pastikan juga bahwa email yang digunakan adalah email yang sama dan tentunya yang tepat. Dimohon peserta menuliskan nama lengkap di live chat YouTube dan Zoom Meeting dengan format tulisan nama lengkap, spasi, asal institusi. Next slide. Baik, sertifikat kali ini merupakan akan mendapat 3 SKP dari IBI dan wajib mengikuti semua 70% durasi setiap tayangan ini dan mengisi link absensi dan evaluasi. Pastikan menggunakan email yang sama dan menggunakan huruf kapital. Next slide. Ini merupakan link registrasi dan mungkin untuk lengkapnya nanti ada di description box yang ada di YouTube, dan juga nanti dari tim admin dari YouTube juga akan men-share di live chat. Next slide. Absensi. Absensi ini akan kita buka di pukul 14 sampai pukul 16. Dan pada pukul 16 absensi akan ditutup. Dan link evaluasi akan dibuka pukul 16 dan ditutup esok hari pukul 9. Saya bacakan ulang bahwa link evaluasi yang menjadi prasyarat untuk keluarnya sertifikat akan dibuka pada pukul 16 dan ditutup pada pukul 9 esok hari. Next slide. Jika Bapak, Ibu, Saudara-saudari ada pertanyaan, silahkan menuliskan di link berikut. Next slide. Sertifikat yang didapatkan, SKP yang didapatkan, kita dapatkan dari Pengurus Pusat Ikatan Bidan Indonesia dengan nomor SK 6731-S-SKP IB-9-2020. Sekali lagi, mungkin untuk sertifikat ini, untuk peserta mendapatkan 3 SKP. Silakan. Untuk e-sertifikat akan dikirimkan langsung ke email yang digunakan saat registrasi, daftar hadir, dan mengisi evaluasi. Sekali lagi, sertifikat akan dikirimkan langsung ke email yang digunakan saat registrasi, mengisi daftar hadir, dan mengisi evaluasi. Jadi pastikan Bapak, Ibu, Saudara-saudari sekalian mengisi email ya dengan tepat. Terima kasih. Baik, Bapak, Ibu sekalian, dan para hadirin sekalian, dan juga para pemateri yang saya hormati, sebelum kita mulai acara seminar kali ini, izinkan saya menyampaikan, memperkenalkan rekan saya yang akan memandu diskusi kita hari ini. Dengan senang hati, saya akan memperkenalkan rekan saya, Mergi Gayatri, SST, Master of Science. Boleh diperlihatkan CV-nya, panitia? Ya, berikut adalah moderator kita yang akan memimpin diskusi kita hari ini. Mergi Gayatri, SST, MSc, akan bertindak sebagai moderator pada kegiatan kali ini. Rekan saya ini merupakan dosen di jurusan kebidanan dan juga sebagai anggota peneliti di FKUGM. Pendidikan terakhir yang ditempuh diambil di Nottingham University, United Kingdom, dan banyak sekali pengalaman penelitian yang sudah dilakukan. Dan boleh dibaca. Ini adalah pengalaman-pengalaman penelitian yang telah diambil. Terakhir, tentang situation analysis of tuberculosis in Indonesia in menggunakan mixed method study. Baik, Mergi, will you please welcome Mergi, and the time is yours.
Eva. All right, the Honorable Dr. Eriko from the Faculty of Medicine, Universitas Brawijaya, the respectable Dr. Yahya Irwanto, OG consultant, the head of School of Midwifery, Faculty of Medicine, Universitas Brawijaya, the distinguished guests from Indonesian Midwifery Education Association, Indonesian Midwives Association, the UNICEF Indonesia, Madam and Mr. Speakers, fellow lecturers, students, ladies and gentlemen. Good afternoon. Assalamualaikum warahmatullahi wabarakatuh. First of all, I would like to welcome you all to today's seminar about maternal health and adaptation to new habits era held by the School of Midwifery, Faculty of Medicine, Universitas Brawijaya. My name is Mergi. It's a great honor to be here amongst you. It is indeed great privilege to be the moderator of this online seminar. All right. In this occasion, we shall have outstanding presentations from our speakers, whom I believe shall enrich your insights and knowledge regarding maternal health during the COVID-19 pandemic from various settings. Before we get started, I would like to go over a few items so you know how to participate in today's event. Every presenter will speak for approximately 15 minutes and will be continued by Q&A session. So ladies and gentlemen, if you have any questions, please write them on the Google form, which the link will be informed on our YouTube description box. And you can also write your question in Indonesian because we will translate it into English. Before the presentations begin, allow me to introduce the speaker. Our first speaker is Associate Professor Louis Walker from the University of Nottingham. Associate Professor Louis Walker currently works at the University of Nottingham as head of division of midwifery. Maybe someone can help me to share her CV on the screen, please. CV-nya. Okay. As I told you that Associate Professor Louis Walker currently works at the University of Nottingham as head of division of midwifery, lead for education development and global engagement since 2019, UNICEF BFI lead for division of midwifery since 2014, and her background is a midwife. She has long-standing experience in the field, of course. She also has extensive experience in international external works, including Indonesia. He has education project on introducing midwifery students to the world of research, building the basis for the future leaders in evidence-based practice future leaders. In 2019, 6 midwifery students were involved as co-investigators in 2 research studies and were involved in educational and research works activities. All right, so very interesting works. So, Louis, are you ready? Could you? Yes, okay, so without further ado, I would like to welcome Louis to deliver a presentation entitled Maternal Health System During the COVID-19 Pandemic in the UK. So please welcome Associate Professor Louis Walker.
Thank you, and my slides being shared centrally. Yeah. Thank you very much, and welcome everybody. It's good afternoon for you. It's good morning for me, but I'm very happy to be invited to speak to you on this issue and to tell you what's been happening in the UK around the COVID-19 pandemic. There's a few of you I do know because I have done some work in Indonesia, and it was very nice to see some familiar faces today. So we'll have the next slide, please. So I wanted to start off by giving you some background statistics on what's been happening in the UK. And these figures were taken just earlier in the week. So, you know, we've had about 409,000 positive cases within the UK and 41,862 deaths. So it has hit the UK quite profoundly, and within that, I'm going to just focus on maternity. Now, within maternity, we have had some cases of COVID, and from a study that was done by Knight in 2020, we know that that's probably equates to about 4.9 per 1,000 maternities. But what we do know is that most women don't necessarily have a severe illness. Only 10% of women are needing respiratory support, and the women that it is affecting is usually in the late second and third trimester. I think one thing of note that you can see from my slides is that 56% of pregnant women admitted to hospital with COVID in pregnancy were actually from Black or other ethnic minority groups. Now, the UK is a multicultural society, so knowing that people from these communities and ethnic groups are suffering more is actually quite a worry for us, and we are trying to do more research into why these groups are more affected than others, and it is work to be done. Okay, next slide please. So this slide, I'm going to talk to you about the challenges that are happening within maternity services. And as it was globally, it was a real rapid unfolding situation. And we did have to react very quickly to be effective in the way that we were dealing with things. But as was globally, there was quite a lack of evidence base, and as we all know within midwifery, we wanted to work within an evidence base, and that was fairly difficult because we didn't have that to back up what was happening and how we were going to deal with the situation. The other thing that happened was guidance was coming out from different bodies, from our government, and because it was a rapid changing situation, this guidance was changing quite frequently. So within maternity services, you know, sometimes we could have guidance that was being changed throughout the day. So you know, it was quite a difficult situation for staff to undertake. Now, within the maternity services, quite a number of them sit within acute hospitals. So the needs of the maternity services were very often lost within the greater need of the acute hospital. And again, that became a concern within maternity. As you know, we can't cancel maternity care. It's not like cancelling the elective surgery. You know, women continue to be pregnant, babies continue to be born. So maternity care could not be cancelled. So we had to find a way of how we could manage our maternity services. One of the other big challenges were the number of staff within maternity who were needing to shield. Now, our government put out some guidance on certain people within society who had certain medical conditions who needed to self-isolate. And the growing evidence was showing that people who were obese were more at risk of contracting and dying from COVID, and obviously people who had quite serious medical conditions such as severe asthma were recommended to shield. So this meant that our maternity staffing was a lot less than we would normally deal with. Quite a number of staff were also needing to self-isolate because they were either having symptoms of COVID or were living with people who had got symptoms with COVID. So obviously then were advised that they needed to self-isolate and then they couldn't be part of the workforce. Another challenge was very often, called it tension, but we needed to balance the needs of the staff against the needs of the women. And this was very difficult in that we had reduced staffing numbers because of the shielding and self-isolating, but we didn't have any necessarily reduced number in women, and the needs of those women were still the same. But that proved quite a challenge, and when I speak in a few moments, you'll see that there were some services that were suspended. One of the other things, there was a big focus on research that was COVID. So a lot of the non-COVID related research was also suspended. We weren't able to conduct research, any data collection, and that is going to have a knock-on effect for our research from now and informing practice in the future for a short period of time, because that research was put on hold. Next slide, please. Thank you. We did have quite a lot of constructive support within the country. We had a number of large-scale studies that were being using existing systems that we got, and some of you may not be familiar with a system that we've got, that's the UK obstetric surveillance system, and what that was used for was actually to monitor the COVID outcomes of pregnant women admitted to our hospitals. There was also quite a good proactive collaboration. So a lot of different disciplines from research and health professionals did come together to produce regular updated evidence. And this was a great help to us. And we could then really see how things were progressing from the evidence that was being provided. And the Lancet also provided an open resource centre, which is still there for COVID-19, and it's a great place that people can go to get access to those resources. Thank you. Next slide. So if we look about the impact on the role of the midwife, midwives were starting to wear more protective equipment. Now, we all know that from a midwifery point of view, the contact that we have with women is really important. We rely a lot on our non-verbal communication by looking at people, smiling at people, and showing via that how we can communicate. And now our midwives were having to wear masks, we're having to wear goggles, and were unable to touch women the way that it might have done before. So this meant that the midwife had to develop their communication skills and interactions with women in a different way, and as midwives always do, they found a way, and quite a lot was put into how you can smile with your eyes. So even though people couldn't see your face and your lips smiling, that women still knew that you were there smiling and supporting them. So there were a number of midwifery-led services, such as home births, that were suspended in some areas of the country. Now, that was dependent on where you were. In some respect, women didn't necessarily want to come into hospital to have their babies because they felt that the hospitals were an area of risk to them. So they wanted to stay at home. So luckily, in some areas, home birth actually increased. And that service was still there, but it was variant throughout the country. Other services that were severely reduced were around postnatal care. Women in the UK do get visited by the midwives at home to provide care and breastfeeding support. And this was reduced because we weren't putting midwives into situations of going into lots of homes and actually putting themselves at risk as well as the women that they were visiting. So unfortunately, postnatal care did get reduced, and it became more using the telephone so that we could speak to women. But what we did see was a reduced uptake of women on the antenatal services. So the number of women who were presenting with things like reduced movements or abdo pain with during the antenatal period did greatly reduce. And it's going to be really interesting to see figures when they start to get published. Anecdotally, we can see that the number of premature births seem to be reduced. We think the breastfeeding figures are increased, and so there's actually some going to be some figures and data that we can see to how the maternity services changed during that time. Next slide, please. So there was positivity, and I've put with caution because we do need to work on this. There was a really good increase in attention to staff's psychological well-being. The hospital trusts within the country became acutely aware that we had to look after our midwives and take care of that psychological well-being, and so that is a really positive, and we're hoping that that's going to continue. The increase of virtual technology has helped. It meant that women could still interact with their midwife through that technology. It came quite quickly, and again, we need to see whether that is appropriate or not. Again, increased range of the types of consultations that we have needed by women. So, you know, we've greatly looked at, were we doing too much for women? Were we interfering too much? And that again needs evaluating, but it could actually form a new pathway to how we care for women. There's the potential to retain some of these good innovations and changes. We need to demonstrate that there is a benefit, and it's always about the benefit to women. So once we can get research and data collection properly in place, then we can put all these into place. And there are some framework documents that are coming out from our NHS Trust. One of the things that has greatly reduced was the amount of birth support that women could have when they were going into hospital. And in some instances, some women were birthing without their partners. Obviously, midwives are there to support women, but partners play an important role. And there is now a framework that is put together to reintroduce partners into supporting women whilst they're accessing the services. Next slide, please. The ultimate aim really is to continue to provide this care, and this phrase at the moment is about being evidence informed. Sometimes we haven't got a heavy base of knowledge around this, but it can be informed by evidence. But we want to make sure that we're providing our women with equitable, safe and respectful, compassionate care. They are really important, that we don't lose the sight of the woman and her family in providing care, and we need to make sure that we don't focus just on the processes that we have to follow. We have to remember we're looking after women and babies here. And this is backed up by some research that Renfrew et al. Did in 2020. Thank you. Next slide. So there are my references that that you might want to go to, but I would suggest that you can, it's open access, and look at the COVID-19 Resource Centre. So thank you very much for listening, and I hope that has been helpful, and I'm happy to answer any questions that you may have on it. Thank you.
All right, thank you very much, Luis, for the presentation. I mean, it's very interesting that actually it remains a challenge even for the UK, which is the developed country, especially in terms of the maternal health. And like Luis said before that, it's a challenge for us, I mean, for the midwife who wear like a mask or any equipment, that we cannot show that we are, you know, in terms of the communication. So you have to learn how to, you know, show actually that you care about the women, like maybe your eyes, because the women only can see your eyes, right? So yeah, I mean, yeah, it's interesting. And also UK has data on you know, which citizens categories who suffers from COVID-19, and then it's also especially some you know, midwifery-led services such as home birth should be suspended. And I mean, it's very interesting because in Indonesia, home birth is not allowed by the government. So maybe we can share further in the discussion if you are interested to this topic. And also, yeah, reduced uptake by women of antenatal maternity services. And yeah, it's also it's a challenge for us to look for a platform that we can do. Maybe we can still do communication with women, but still, you know, implement the protocol of COVID-19. Okay, and then Luis also provided some literatures so that maybe you are interested to look for, and then you can read after this seminar if you are interested. All right, thank you very much, Luis, for the presentation. Please stay with us, because now I would like to welcome our second presenter, Professor Deborah Turnbull from the University of Adelaide. Okay, and Deb will deliver a presentation entitled Maternal Health System in Australia during the COVID-19 pandemic and the psychological impact of the adapting to new habits era on mothers. Yeah, Luis has mentioned about the psychology. Maybe in this session, Deb, we can also talk about psychology impact. And yeah, Professor Deborah Turnbull holds the chair in psychology at the University of Adelaide. She has been researching into women's health and maternity services since the late 1980s. She led one of the original UK teams to examine midwifery managed teen care. Her research into reproductive health covers a range of topics such as outpatient induction of labor, and more recently, new approaches to intrapartum fetal monitoring for addressing emergency cesarean section. She has a long-standing relationship with Universitas Brawijaya and has been coming to Indonesia regularly for about 10 years. She's currently researching with her colleagues in Brawijaya about the psychological impact of infertility on Indonesian women. All right, so ladies and gentlemen, please welcome Professor Deborah Turnbull from the University of Adelaide.
Terima kasih, Mugi. May I have the screen share, please? Thank you. Could you please send to me the ability to do the screen share?
For sure, if you want to share from your side, please.
Yes, please. I'd like to share from my side.
Okay, just share screen now.
Thank you. Can everyone see my screen share okay?
Yeah.
Already, but not in slideshow mode. This slideshow.
Okay.
We are showing the presenter mode, not the presenter.
Okay, just to check.
Probably you can switch the turn off the presenter view.
Okay.
Can you slideshow?
I'll just try one more time.
You can choose the slideshow option on the box there.
Yeah, on the top of left, you can
left.
You can see the slideshow.
Is slideshow?
Yes, could you please close this first and then you can...
No, that's it.
Have you got it now?
Not yet.
Not yet. Sorry about this.
Swap option. There are swap option on the top left.
That option.
Swap option. Swap display. You can click swap display.
Right. Sorry, we might have to do it centrally.
Okay. Can you give me the remote access?
Just did.
Okay.
Thank you.
Okay. Probably you and the slideshow first.
Yes, please.
I cannot click it. Okay, there you are. On this slideshow, you can go to the slideshow menu. Oh, wait.
Great.
Can you open the PowerPoint again? Okay, and the slideshow. Go to the slideshow menu.
Stop.
You can turn off the presenter view.
Okay.
Try again.
So you need the gallery view?
No, on the slideshow, the slideshow menu on the top, you can click it and then see the presenter view. Turn off the presenter view.
Okay, I think I just did.
Okay, just slideshow again. Can you share screen again?
Okay.
Oh, you can share screen the display, the screen.
Okay.
Then share.
So I can go ahead now?
Yes, try it.
Terry McCussey. So my name is Deborah
No,
Turnbull.
wait. We cannot see your presentation.
Okay.
Because you're not sharing screen.
Okay, just to tick.
Can you share your screen? Okay, can you slideshow? Can you slideshow again? Share screen again?
Yep.
Can you share screen again? Okay. Slideshow.
Okay.
Please slideshow.
Just to tick.
Can you slideshow it?
Yes.
Click the slideshow. The slideshow menu on the top, beside animation, on the right of animation menu, click it.
Can you see it now?
Yes, try to click the slideshow. Okay, nice one. Thank you. You can start.
I'm so sorry about that. Thank you so much for your patience, everyone. And thank you so much to the technician. So I'm going to speak a little bit about the maternal health system in Australia. And also I'm going to concentrate on the psychological impact of COVID and the so-called new normal on Australian mothers. So this is the overview of my presentation. I'll start by giving you a little bit of an overview about the Australian healthcare system and particularly the maternal system. And then I'm going to finish reflecting on what the peak bodies are telling us about the midwife's role in adapting to the new normal. So for those of you who are not familiar with Australia, we comprise of 6 states and 2 territories. And the reason I show you this map is to make the point that the management and the response to COVID in Australia has been very much dominated by the state premiers or the state governments. So the response in Western Australia, for example, will be very different to the response in South Australia. So I'm based down here in South Australia, and at the moment we have very limited restrictions, and we've just had our borders open to most of the states with the exception of Victoria. So we don't have a national response to COVID. It's very much driven on a state-by-state basis. So in summary, the Australian maternal healthcare system, we have a national insurance scheme which is paid for from taxes. So it's a little bit different from the National Health Service in the United Kingdom, but it's also possible for women to receive privately funded care. And the maternity system is a shared responsibility of the Australian and the state territory governments. And women receive care both in the private for-profit and not-for-profit sectors, as well as the public sector. So you can see from these data here that Australia is very different from Indonesia. We only have per annum a little over 300,000 babies born. 1 in 3 of the deliveries are through caesarean section. Very importantly and encouragingly for us, there have been positive trends for Indigenous mothers in terms of antenatal care attendance, smoking, and small for gestational age babies. I was also asked to comment on maternal deaths in Australia, and the maternal mortality rate in 2017, the year for which the most recently published data are available, was 6 deaths per 100,000 women. Interestingly and importantly for us, a critical challenge is for Aboriginal and Torres Strait Islander women, because they continue to have a higher incidence of maternal death than non-Indigenous women. Now, in relation to COVID, and these are the data from my state, the state of South Australia, which has a little over 1 million people. You can see here that we've had about 230 female cases, 236 male cases. There have been 4 deaths. So the data are quite in contrast to the very interesting data that Louise has just shown us. The majority of people who are affected by COVID are in their older ages, and we have had quite a very big response in terms of our aged care sector. It's been dealt with, I think, in a way which a lot of people would regard as deeply inadequate, and we're trying to redress that. So what are the psychological challenges for women? Well, these are some very interesting data that have been recently distributed by the Australian College of Midwives, a survey of over 3,000 women throughout the country. And this is what the women's experiences of accessing maternity care during COVID were like. around 30% of women reported reconsidering their care provider and or their birthing venue, with the major trend being towards home birth options. And similarly, there was a trend towards women accessing private care from a private obstetrician in a private hospital or from midwives in a private practice. So these are the some of the big trends we're seeing in service access. Now, this is some other interesting data from this particular report because it gives us very good insights into the concerns of women. And what you're seeing here is that 74% or 73% of women were worried about giving birth alone. I have to say, though, that in the end, this was not the case. There were no restrictions on the partners coming into the labour ward with the women. 58% or 59% of the women were worried that they wouldn't have support when they needed it, when they came home with their baby. And another important finding was that 48% of them were worried that they'd have to leave the hospital early. And very importantly, 68% of them were worried that COVID would affect their baby's health. So this is what the midwives are being challenged by, and this is some of the responses that they're making in relation to encouraging mothers to adapt to the new normal and to make new routines. Firstly, they aim to find out from the women what their current routines are like, what sort of safe practices they're putting in place. And then what they're doing is reinforcing the positive routines, such as hand washing, and wherever possible and practical, cueing new positive routines, like social distancing. They're also being challenged by addressing negative routines and trying to do this in a respectful way. And some of the strategies that they're putting in place is to encourage women to pay attention to the environment around them, their social distancing, to set some goals about their behaviour. And also, and it was interesting to hear Louise say this, is there's been a real drive for the midwives to not just practice compassion with the women and continue to do that, but also practice compassion with each other. I put this slide up because I think it's a great example of some of the techniques and the strategies that midwives and others can put into place in encouraging making new routines. This is a paper which gives some guides about so-called motivational interviewing, which is a very effective technique for exploring ambivalence about making behavioural changes and also encouraging behavioural changes. So now I'm going to turn briefly to the strategies for responding to the challenges, and I'm going to talk about some of the strategies that we're putting into place at a systems level. So firstly, there was an announcement on the 8th of September that there's going to be the formation of a rapid response nursing and midwifery service. And our state is trying to recruit up to 150 dedicated nurses and midwives. And there's also been the formation of a new leadership team, the Director of Nursing for COVID-19 and Nursing Midwifery Director for a new Medi Hotel, which is being formed. These are the kinds of recommendations that the Australian College of Midwives are promoting, and you can see they include greater access to midwifery continuity of care and carer. And I'm pleased that we're going to be having a talk about this in a couple of weeks' time, because there's very good evidence that midwifery continuity of care models can be very efficacious in providing high quality care for women. They're also recommending things like the expansion of publicly funded home birth and also the development of evidence-based guidelines for this and for future pandemics. So there is some quite excellent resources available, both from the Australian College of Midwives and also from the Royal College of Obstetrics and Gynecology for both how you provide advice to women who are at risk and also those who have been suspected or diagnosed with COVID. And also, finally, the midwives in Australia, just like the midwives in the UK and in Indonesia, are being challenged by adapting to their new roles around enhancement of hygiene, physical distancing. And it was so interesting to hear Louise talk about physical distancing and some of the non-verbal cues to convey to women, and also the use of personal protection equipment. And lastly, Mergy asked me to comment on breastfeeding, and I'm going to be so interested to hear Louise talk about this because she'll be in a way better place than me to comment on it. But I bring up this advice from UNICEF, which was published in March of this year, which says that mothers with suspected or confirmed COVID and isolated at home should be advised to continue recommended feeding practices with necessary precautions during feeding. So in conclusion, I've shown you on the left-hand side of the screen a sign that was actually put up in one of our national parks that I bushwalk in very regularly. And it's signs like this that are being promoted throughout the state and throughout the country. And so we are encouraged to keep a distance of 1.5 meters between people, which for your information is at least one adult kangaroo apart. So I think that the challenge is that we are in a situation whereby there's a need for a multifaceted response at both the individual level, so at the level of the midwife and at the individual woman and her family, as well as a broader system level response. And I've tried to show you some examples of what we're doing. And also remembering that we're definitely all in this together. Terima kasih banyak.
Terima kasih, Deb, for the presentation. So it's very interesting. Deb showed the data that the maternal mortality rate in Australia was 6 per 100,000 living birth, and it's a big gap with Indonesia because in 2015 it was 150, if I'm not mistaken. So it's a very big number. So I think it's a very great opportunity for us. Maybe in the future we can do some projects or like together to help the maternal health services in Indonesia better. And yeah, it's the conditions in Australia is very similar with the UK actually.
Yes.
We also prefer midwife, or there were like 52%, right, of women choose the midwife, and then they also reconsidered at 30% of women reported reconsidering their care provider, including also home birth. Yeah, it's also interesting. And then, yeah, there's some strategies also the information about breastfeeding because there are some evidence that showed us that from the UNICEF, it's mothers with suspected or confirmed COVID-19 and isolated at home should be advised to continue recommended feeding practices with necessary precautions during feeding. So the key word is actually precautions because COVID-19 is about, it's very easy to transfer to others. So that's why it's very important to have like social distancing and so whatever. And okay, thank you very much, Professor Deborah Turnbull from the University of Adelaide for the presentation. Now, ladies and gentlemen, let's welcome our third presenter, Dr. Michelle Dines from the UNICEF East Asia and Pacific Regional Office. Dr. Michelle Dines is an immunization demand specialist with the UNICEF East Asia and Pacific Regional Office in Bangkok, Thailand. As lead researcher for the health section, she supports research, programmatic, and evaluation activities across